Dear all, we often hear that fruits are a great source of food for health and longevity. That's right. But have we ever wondered, are there any fruits that are not really good for the elderly? The answer is yes. Some fruits can have negative effects on health if used incorrectly or consumed in excess. And today, I would like to share with you 7 fruits that can be dangerous for the health of the elderly. First, durian, the king of bad cholesterol. Durian is a nutritious fruit but is also controversial in terms of its health effects, especially related to cholesterol and cardiovascular disease. With a high calorie content and a significant amount of saturated fat, durian can increase LDL cholesterol, bad cholesterol, levels in the blood, contributing to atherosclerosis, high blood pressure, and cardiovascular disease. However, the fat in durian is mainly monounsaturated fat, similar to that in avocados, which can be beneficial for the heart when consumed properly. In addition, durian contains a large amount of calories, 140-160 kcal/100 g, so eating a lot can lead to overweight and obesity, which is especially dangerous for people at risk of metabolic syndrome, diabetes, or cardiovascular disease. Another important factor to note is the dangerous effects of combining durian with alcohol. Durian contains sulfur compounds that can inhibit the enzyme aldehyde dehydrogenase in the liver, making it difficult for the liver to metabolize toxins from alcohol, leading to the accumulation of acetaldehyde in the blood, causing nausea, rapid heartbeat, and even sudden increase in blood pressure, which is very dangerous for people with a history of cardiovascular disease. However, durian is not entirely harmful. This fruit is rich in fiber, which helps with better digestion, and also contains many antioxidants such as vitamin C and flavonoids that are beneficial for heart health. The high potassium content in durian also helps regulate blood pressure if consumed in moderation. Therefore, although it can increase bad cholesterol when eaten too much, durian still brings certain benefits if used properly. People at risk of cardiovascular disease, obesity, or diabetes should limit consumption and absolutely avoid eating durian with alcohol to prevent dangerous complications. Second, jackfruit, diabetes risk and internal heat. Jackfruit is a nutritious fruit but also has many potential health risks, especially affecting blood sugar, liver, and digestive system. With a high sugar content, mainly glucose and fructose, jackfruit has a high average glycemic index, 50-75 depending on the type, which can cause a sudden increase in blood sugar after eating. This is especially dangerous for people with diabetes or prediabetes, as it can cause the pancreas to produce more insulin, causing loss of blood sugar control and increasing the risk of complications. For people with fatty liver, consuming a lot of sugar from jackfruit can promote the conversion of sugar into fat in the liver, worsening non-alcoholic fatty liver disease. In addition to the risk of diabetes, jackfruit is also hot according to Oriental medicine because it contains a lot of sugar and high energy, 95 kcal/100 g. When consumed in large quantities, the body will generate heat, increase sebum secretion, causing acne, prickly heat, especially in people with hot constitutions. In addition, the high amount of sugar in jackfruit can also cause an imbalance in intestinal bacteria, making the digestive system susceptible to problems such as bloating and indigestion. To reduce the risk of internal heat, you can combine jackfruit with cooling foods such as green vegetables, coconut water, or drink enough water to help the body balance temperature. The insoluble fiber content in jackfruit helps aid digestion, but eating too much can cause bloating and indigestion due to the digestive system being overloaded. In particular, for people with weak digestive systems or stomach ulcers, jackfruit can irritate the stomach lining, leading to abdominal pain or indigestion. In addition, jackfruit contains tannin, a compound that can reduce the absorption of iron and protein, affecting the digestive process if consumed regularly. In the elderly or people with poor digestive function, eating a lot of jackfruit can increase the risk of constipation or indigestion. Although jackfruit has many nutritional benefits, eating too much can have negative effects on health, especially for people with diabetes, fatty liver, and weak digestive systems. To take advantage of the benefits without side effects, eat in moderation, drink enough water, avoid eating at night or on an empty stomach. People with a history of diabetes or digestive problems should consult a doctor before adding jackfruit to their daily diet. Third, lychee, Longan, culprits of hypotension and internal heat. Lychee and Longan are two popular fruits, with a rich sweet flavor and rich in nutrients, but also pose many potential health risks, especially affecting blood pressure, blood sugar, and internal heat. With high sugar content, mainly glucose and fructose, they can increase blood sugar rapidly after eating, causing the pancreas to react by secreting insulin to lower blood sugar. For normal people, this process is stable, but for people with low blood pressure or diabetes, strong fluctuations in blood sugar can cause reactive hypoglycemia, leading to fatigue, dizziness, sweating, and even fainting, especially if eaten on an empty stomach or consumed in large quantities in a short period of time. Not only affecting blood sugar, lychee and longan are also hot according to Oriental medicine, easily causing the body to lose its thermal balance, especially in the summer when the temperature is high. When eaten in large quantities, the body will generate a lot of heat, stimulating the secretion of sebum on the skin, causing acne, prickly heat, and mouth ulcers. The high sugar content in these two fruits can also increase the activity of bacteria and yeast, making skin inflammation or mouth ulcers worse. In addition, they can cause dehydration by increasing heat and speeding up the metabolism, making the eater feel constantly thirsty, dry throat, and even at risk of heat shock if not hydrated enough. To limit this effect, you can combine eating lychee and longan with cooling foods such as green vegetables, coconut water, or drink plenty of water to help the body balance its temperature. The high sugar content in lychee and longan also affects the digestive system, can cause bloating, indigestion, especially in people with weak digestive systems or stomach diseases. When eaten in excess sugar can ferment in the intestines, causing bloating, diarrhea, or digestive disorders. Some people may also experience allergic reactions to these two fruits, manifested by hives, itching, or even anaphylactic shock in sensitive people. Despite their high nutritional value, lychee and longan should be consumed in moderation to avoid negative effects on blood pressure, blood sugar, and internal heat. People with low blood pressure, diabetes, or a hot constitution should limit eating a lot at one time, avoid eating when hungry, and drink enough water to reduce the risk of dehydration and internal heat. To enjoy the nutritional benefits without side effects, eat in moderation and combine with a balanced diet. Fourth, ripe bananas, a double-edged sword for the heart. Bananas are a nutritious fruit, especially beneficial for the heart thanks to their high potassium content, which helps regulate blood pressure and support heart function. For normal people, a diet rich in potassium helps lower blood pressure, reduce blood vessel tension, and improve heart health. However, for people with kidney disease, the ability to filter potassium is reduced, leading to hyperkalemia, causing heart rhythm disturbances, muscle weakness, cramps, and even cardiac arrest if potassium increases too much. Therefore, patients with kidney failure need to strictly control the amount of potassium consumed and limit the consumption of ripe bananas. In particular, for people with heart disease and impaired kidney function, absorbing too much potassium from bananas can cause irregular heartbeats, endangering life. Although potassium is beneficial for the heart, if the amount of intake is not well controlled, it can become a worrying risk factor. Not only affecting the cardiovascular system, bananas also have a significant impact on the digestive system. Ripe bananas have a soft texture, contain a lot of soluble fiber, help support digestion, and prevent constipation. However, if you eat bananas when hungry, especially in people with sensitive stomachs or stomach pain, it can cause bloating, indigestion, and even irritation of the stomach lining. The reason is that bananas contain a certain amount of natural acid and serotonin, a substance that can stimulate the stomach to secrete more acid, causing discomfort and nausea. In addition, bananas also contain tannin, a compound that slows down protein digestion, causing food to stay in the stomach longer, causing bloating and indigestion. People with stomach ulcers or acid reflux who eat bananas when hungry can worsen symptoms of stomach pain and nausea. Bananas may also be associated with the risk of muscle cramps. Potassium plays an important role in maintaining muscle contraction and relaxation, but if consumed in excess, especially when the kidneys cannot effectively filter potassium, It can cause involuntary muscle contractions and increase the risk of prolonged cramps. Although bananas are a nutritious fruit, they can become a potential risk for kidney patients or people with digestive problems. People with kidney disease should limit their banana intake to avoid hyperkalemia, which can cause heart rhythm disturbances and kidney failure. People with stomach pain should not eat bananas on an empty stomach to avoid irritation of the stomach lining and indigestion. Banana consumption should be adjusted to suit your health condition to take advantage of the benefits without causing harm to the body. 5th, ripe mango, blood sugar and stomach affected. Mango is a popular fruit, rich in nutrients with many vitamins and minerals, but it also has potential negative effects on health, especially for people with blood sugar and digestive problems. With a high sugar content, mainly glucose and fructose, mango can increase blood sugar quickly, especially in people prone to diabetes. Although the glycemic index of mango is not too high, if eaten in large quantities or on an empty stomach, blood sugar levels can increase suddenly, posing a danger to people with diabetes or at risk of diabetes. Older people, who often have metabolic problems and poor blood sugar regulation, are prone to type 2 diabetes. Excessive mango consumption can make it difficult for them to control blood sugar, thereby increasing the risk of complications such as kidney, nerve, and blood vessel damage. In addition to affecting blood sugar, mangoes are naturally acidic, which can irritate the stomach, especially for people with weak digestive systems or stomach conditions such as stomach ulcers or gastroesophageal reflux. The acidity of mangoes can increase the secretion of stomach acid, leading to heartburn, bloating, and acid reflux, making people with stomach ulcers feel pain and discomfort. Compounds in mangoes, such as tannins, can slow down digestion, causing food to stay in the stomach for a long time and causing bloating and indigestion. People with stomach conditions or those prone to acid reflux should limit their intake of mangoes, especially when hungry or during main meals. For people with stomach ulcers, eating mangoes can aggravate the condition, irritate the stomach lining, and increase the risk of serious ulcers. Therefore, mango consumption for these people needs to be carefully controlled to avoid side effects. In short, although mango is a nutritious fruit, with its high sugar content and natural acidity, it can cause side effects for people with diabetes and digestive problems. The elderly and those with blood sugar problems should limit their intake of mangoes to avoid sudden increases in blood sugar, while those with stomach ulcers or acid reflux should avoid eating mangoes to protect their stomach health. Mango consumption needs to be adjusted to each health condition to take advantage of the nutritional benefits without experiencing side effects. 6th, watermelon. The culprit causes hypotension and blood sugar disorders. Watermelon is a popular thirst-quenching fruit with abundant water content and natural sweetness, but at the same time it also poses some potential health risks, especially for those with blood pressure and blood sugar problems. Although watermelon is very good for the body in the summer, if not eaten properly, it can cause some serious health problems. Watermelon contains a high amount of natural sugar, mainly fructose and glucose, which helps provide energy to the body quickly. However, because it contains a lot of sugar, when eating watermelon, blood sugar levels can increase rapidly, especially for people who are prone to diabetes. Although the glycemic index of watermelon is not too high compared to other sweet fruits, when eating watermelon in large quantities, the body can absorb too much sugar, causing a sudden increase in blood sugar. This is especially dangerous for people with type 2 diabetes or those in the pre-diabetic stage, because fluctuations in blood sugar can lead to dangerous complications such as damage to blood vessels, kidneys, and nerves. In addition to affecting blood sugar, watermelon also affects blood pressure. Watermelon can lower blood pressure thanks to citrulline, an amino acid that helps dilate blood vessels and improve blood circulation. However, for people with low blood pressure, eating too much watermelon can lead to a sudden drop in blood pressure, causing fatigue, dizziness, and even fainting. People with low blood pressure already have problems with blood circulation. When eating watermelon, strong vasodilation can lower blood pressure to dangerously low levels, especially if watermelon is eaten at a time when the body is weak or tired. Watermelon also has a diuretic effect, causing the body to excrete a lot of water, leading to a decrease in the amount of plasma in the blood, causing blood pressure to drop rapidly. Therefore, People with low blood pressure should avoid eating too much watermelon at once, especially at times when they do not have enough energy or when the body is feeling tired. Another problem with watermelon is that when eaten at night, especially cold watermelon, it can cause digestive disorders. Although watermelon is cool, when eaten cold it can irritate the stomach and reduce the digestive capacity of the digestive system. In particular, when eating cold watermelon at night, the body has not had time to fully digest it, causing a feeling of heaviness in the stomach, bloating, and diarrhea. People with sensitive digestive systems or stomach diseases such as stomach ulcers or acid reflux should limit eating cold watermelon at night. If eaten at this time, the body will have to work extra at night to digest, affecting the quality of sleep and increasing the feeling of discomfort the next morning. In short, although watermelon is a nutritious fruit, with its high sugar content and natural cooling properties, it can cause side effects for people with diabetes, low blood pressure, and digestive problems. People with low blood pressure should avoid eating too much watermelon to avoid a sudden drop in blood pressure, while people with diabetes need to control the amount of watermelon consumed to avoid increasing blood sugar. In addition, cold watermelon, especially when eaten at night, can cause digestive disorders, bloating, and diarrhea. Therefore, eating watermelon needs to be properly controlled to take advantage of the benefits without experiencing side effects. 7th, guava's constipation and digestive system is affected. Guava is a very nutritious fruit, rich in vitamin C and fiber, especially insoluble fiber, which helps support digestion and maintain intestinal health. However, despite its many benefits, guava also has potential risks if not eaten properly, especially for the digestive system and people with dental or digestive problems. Guavas are high in insoluble fiber, a type of fiber that helps increase bowel movements and soften stools, thereby aiding digestion. However, eating too much guava, especially when consuming the seeds, can have the opposite effect, causing constipation. When consuming too much insoluble fiber, the body will have difficulty absorbing water, making stools dry and difficult to move through the colon, leading to constipation, bloating, and indigestion. This is especially dangerous for people with sensitive digestive systems or problems such as irritable bowel syndrome, IBS, as they may experience more severe discomfort when eating too much guava. In addition, guava peel contains a large amount of tannin, an astringent compound that can slow down digestion. Although tannins have anti-inflammatory and antibacterial properties, consuming too much guava peel can cause stomach upset, slowing down digestion and causing a feeling of fullness or bloating. People with weak digestive systems or stomach conditions such as stomach ulcers or acid reflux may experience these symptoms when eating guava peel, as tannins can irritate the stomach and reduce the ability to digest food. In particular, guava peel can increase stomach acid levels, causing pain or a burning sensation in the stomach, aggravating conditions such as heartburn or acid reflux. In addition to digestive problems, guava can also be difficult for the elderly to eat, due to its hard nature. For the elderly with weak teeth, eating guava can cause toothache or difficulty chewing, especially when eating guava that is not fully ripe. The hard structure of guava can cause damage to teeth and gums, or make the elderly feel uncomfortable when eating. For easy consumption, the elderly should choose soft, ripe guava and cut it into small pieces to avoid pain when chewing. In short, although guava is a nutritious fruit, improper consumption can have side effects on the digestive system and oral health. Eating too much guava, especially when eating the seeds, can lead to constipation and indigestion, while the guava peel can slow down the digestive process. The elderly should also be careful when eating guava, especially if they have dental problems. To take advantage of the benefits of guava without side effects, it is necessary to consume guava reasonably, avoid eating too much at once, and choose the part of the fruit that is easier to eat. Dear friends, not all fruits are completely good for health, especially for the elderly. It is important that we eat the right type, the right amount, and the right way. If you love a fruit on the list above, you can still enjoy it in reasonable doses and do not eat it on an empty stomach. Hopefully this information will help you have a more reasonable diet, thereby maintaining your health and prolonging your life. Thank you for listening. Don't forget to like and subscribe, so we can continue sharing helpful advice together. Thank you for watching, and I'll see you in the next video.